ICD-10 6 Steps for Success training. As your practice advocates, we are excited to show your practice how to make it through the upcoming ICD-10 transition. We are confident that with good planning and implementation, it can be done. Today's webinar is going to provide you a great toolbox of strategies to ensure this happens. We all know that ICD-10 is fast approaching, and the deadline of October 1st is looming closer and closer. And we have all seen CMS repeatedly push back this final deadline. However, this time it's pretty clear that CMS will not be extending this deadline. So the time has come to finalize your ICD-10 implementation plans and get your practice on the road to success. There is no doubt that ICD-10 is a complex process and will impact your entire practice's workflow and, more importantly, your reimbursements. But with careful planning, you can successfully navigate the ICD-10 path and be ready for the October 1st deadline. Today's presentation will be hosted by Heather Miller. She holds an MBA from Rollins College. She's a certified physician practice manager and a certified professional health information technologist. She has 20-plus years of healthcare management experience, provider advocate with experience in providing comprehensive medical consultations and revenue cycle management, Medicare and Medicaid compliance, practice workflow analysis, electronic health records, and strategic business planning. Before we get started with today's presentation, let's lay a few ground rules. We will be addressing all questions at the end of the presentation during the question and answer period. Should you have any questions come up while she is presenting, please submit them through the Submit Questions window on the right-hand side of the webinar panel. We will then attempt to answer all questions during the question and answer session at the end of the presentation. Any questions we are not able to get to will be addressed directly with you after the presentation is complete. A complete list of all questions with answers will be sent to each attendee. We are also excited to announce that this webinar is approved AAPC course, and each of you will be eligible for 1 CEU credit towards your certification. We will provide you with the certificate information at the end of our presentation. So I will now turn our presentation over to Heather.
Hello, and thank you for attending our ICD-10 6 Steps for Success webinar. I'm going to review real quick our agenda for today's presentation. We're going to begin this journey discussing the history of ICD-10. We'll then discuss some differences between ICD-9 and ICD-10 and highlight some of the limitations and benefits of each of these coding systems. Finally, I will be sharing with you NCG's 6 easy steps to a successful ICD-10 implementation, along with some additional resources that you can use in your ICD planning. Let's begin with the history of ICD-10. As you can see by looking at this timeline, coding classifications have been in place since the 1850s. The first edition, known as the International List of Causes of Death. This was adopted by the International Statistical Institute in 1893. We then saw WHO, the World Health Organization, take over the responsibility for ICD code creation in 1948. Then in 1990, the World Health Agency endorsed the ICD-10 nomenclature that explained the use of ICD-10 and its most current revision we see today. Since then, many European countries have began utilizing the ICD-10 version, starting with the United Kingdom in 1995, while the U.S. has lagged behind and only implemented the mortality codes in 1999 on death certificates. So now we are ready to begin, and on October 1st of 2014, we have an established deadline to implement ICD-10 in the United States. That's 12-plus years from our neighboring countries, showing all of us we are way behind the curve. So now that you have a brief explanation of how ICD-10 evolved, I'd like to talk a little bit about how ICD-10 is different from ICD-9. The first noticeable difference is the field length. ICD-9 codes are up to 5 characters, while ICD-10 codes can go up to 7 characters. The second difference is the gross number of available codes. ICD-9 has approximately 14,000 codes, where in ICD-10 we will have roughly 69,000 available codes. This will add flexibility for when new codes are needed. With such a large change in the number of codes, you can be sure that there will be a difference in your coding, so you will need to understand how to effectively search for codes under the new system. The third difference is the code composition. For ICD-9, the first character could be alpha or numeric, and then all other numbers were numeric. In ICD-10, the first character is always going to be alpha, the second character is always numeric, and then the following characters will be either alpha or numeric. ICD-10 is also generally more specific than ICD-9, allowing for descriptions of etiology and causation, complications, and detailed anatomical location and lateralization. For example, ICD-9 codes do not include laterality, where ICD-10 codes will often identify right versus left. Let's look at an example. In this instance, the code for open fracture of head radius in ICD-9 is 813.15. The code does not specify laterality. Compare this to the ICD-10 code S521.22C, displaced fracture of head of left radius, initial encounter for open fracture type 3, A, B, or C, clearly showing a major change in how we will be coding in October 1st of 2014. So now that we understand some of the key differences between the two, let's discuss some of the limitations we have been encountering with ICD-9 and lead into some of the benefits we will see with moving to ICD-10. So the number one limitation with ICD-9 is that it's old. It's over 20 years, and it is way outdated for today's healthcare system. This older nomenclature leads to the following three key limitations. ICD-9 lacks clinical specificity to accurately process and reimburse claims. It also fails to capture the key details of a patient's condition for recording and exchanging pertinent clinical information. And finally, with only 5 characters in length, there are code ranges with no numerals left. This makes it very difficult to account for complexity and severity in an orderly and easy-to-use manner. So most of these limitations are going to be addressed with the new ICD-10 nomenclature, leading us to the benefits of ICD-10. The number one benefit that ICD-10 will bring is a detailed coding that refines and improves operational capabilities and processing. You might ask yourself, well, how does it do that? Well, this is going to be easily achieved due to these 4 benefits of the ICD-10 system. Number one, we have a detailed health reporting and analytics, including the cost, utilization, and outcomes. We have detailed information on conditions, severity, comorbidities, complications, and location. Number 3, we have an expanded coding flexibility by increasing our code length to the 7 characters. And finally, it's going to improve operational processes across the healthcare industry by classifying detail within codes to accurately process claims and reimbursements. While this vastly increased number of codes might spark fear in the hearts of all of us, we must believe that this meticulous level of detail is actually the code's chief benefit and will in the end improve patient care and research efforts, as well as lend insight to the creation of new health policies due to the improvement in the health reporting and tracking. So now that we've covered some differences in the codes and the benefits, let's review some of the differences between the actual ICD-9 codebook and the ICD-10 codebook. As you can see, chapters have been moved, replaced, or deleted. Common terms have changed. In ICD-10, we will see a long list of new terms that were not included in ICD-9. Granularity, laterality, principal diagnosis, morbidity, mortality, and rubric. Combination codes have been added, and the order of these codes becomes a requirement with ICD-10, very different than what we are used to today. Document requirements are also going to vary greatly by specialty or clinical domain. For example, codes for ophthalmology have had minor changes, while codes related to rheumatology and musculoskeletal systems have increased substantially. Please do not assume that your years of coding or practicing medicine will successfully prepare you for this transition. Having a solid implementation plan is key to this transition. We cannot stress this enough, and is the reason we are providing you with this presentation and sharing 6 success strategies for you to follow in your upcoming ICD-10 implementation, because this transition is going to affect your entire practice, as we can clearly see by this next slide. This slide demonstrates how ICD-10 impacts all sides of your practice, from the front desk to the back desk and to the full clinical team within your office. It's a full circle effect, reiterating the importance of a strong implementation plan. So let's now take a look at the 6 success strategies for your ICD-10 transition. Strategy number 1, assess, create, and assign. Number 2, code translation. Number 3, chart review. Number 4, technology evaluation. Number 5, staff education. And number 6, monitor for success. So let's take a little bit more detailed look at each of these steps. As we all know, each of our practices have their own pulse and lifestyle, so it's very important that the first step in this process is to evaluate your current workflow. This ICD change is going to have an impact on everyone, from the referral team, the clinical team, and the billing team. So it's going to be vital that you assess your full office workflow from the desk to the back office functions. If you ask me who's going to be impacted by this, I will remind you, everyone is going to be impacted, so don't exclude any staff members from this transition. So now that you've assessed your workflows, you will need to create an implementation plan. This will require you, one, to set a timeline. It needs to be reasonable and an implementation plan that's realistic. In order to do this, you must consider your available resources. This is going to provide you a true picture of your needs moving forward. You must consider a budget. The implementation is not going to be free. Time for staff training, tools including new books and reference materials, as well as any unexpected rejections will have an impact on your finances. The CMS team has recommended practices secure a loan as a possible backup for these payment delays. And to ensure your implementation stays on track, you will need to develop a metrics system to measure your success. Benchmarking your performance will prevent your practice from any potential pitfalls during this transition. And the final stage in this first step is to assign. The first part of this is going to be to choose an ICD-10 practice champion. This should be the person on your staff that is best equipped to oversee and implement your practice ICD-10 plan. This person should be well respected by your team and be a reliable source of knowledge for everyone. This will be a key player whose job it is to monitor and ensure implementation plans are successful. The second step is to assign and assess your staff training needs. You're going to be looking at their roles and assigning their role in the practice workflow. Different staff within your practice are going to require different training based on their involvement with the codes. This is the time now to assess these needs to the specific training roles. So this ICD-10 transformation is going to impact all aspects of the practice. The first step of assess, create, and assign is vital to the success of this change. So now that we've identified our plan, let's look at step 2, code translation. Because this is going to be a very overwhelming process, it will be helpful first to complete an ICD-9 usage analysis. This will allow you to prioritize which codes to map first. And this can be accomplished by running a managed care analysis for an annual year. So now that you have a code list, you can prioritize these codes by usage, a key strategy for not getting overwhelmed at this stage. Let's only focus on our frequently used or specialty-specific codes at this stage of the game. So once you've identified the top codes, you should complete a code mapping to the ICD-10 codes for each identified priority ICD-9 code. Lastly, it will be important to create resources such as flashcards or cheat sheets. These need to be created during the mapping process and then used to assist with training and implementation down the line. So now that we've identified and mapped out our priority codes, we now need to review our clinical documentation to ensure it will support the new ICD-10 code rules. This leads us to step 3, chart review. A chart review will need to be completed for each provider in the practice. To be sure that your practice completes this step effectively, this audit should be conducted by an experienced certified code professional. A trained ICD-10 coder will be able to identify whether the physician's chart documentation will justify the accurate ICD-10 code selections. A trained auditor is going to be asking 2 questions when they are reviewing your physician charts. Number 1, do your provider notes accurately reflect what was done during each encounter? And number 2, do your provider notes support the code's build? A trained auditor will then document all charting gaps that are discovered. These gaps will then be reviewed and provide an illustration of the impact of ICD-10 will have on your practice's clinical documentation. This will be key information to use when setting up the training plans for the clinical practice team, highlighting any documentation that is currently lacking and that will now need to be included for the ICD-10 codes. So moving forward in our steps for success, let's now talk about technology. As we all know, how much technology is playing a role in our medical practices. It cannot be left out. Leading us to step number 4, technology evaluation. This implementation is going to require significant changes to the clinical and administrative systems that capture and report diagnosis codes. So the first question you need to ask yourself is, am I 5010 compliant? By now, you should have updated your HIPAA transactions from version 4010 to 5010. This update must be completed before implementing the ICD-10 code sets. Compliance for 5010 was back in January of 2012, so let's just hope we all just answered yes to this first question. The second step is this evaluation is to identify your current systems and processes that are going to be impacted by the ICD-10 code change. The structural differences between the codes will make converting to the updated code set complex. The change in character length requires system updates to expand data fields for the longer codes. Because of this major difference, technology vendors will need to make changes to be compliant, and these changes and updates will have a direct effect on your staff and how to use the new and improved software. So you cannot assume that all of your healthcare technology will automatically be ready. It is your responsibility to ensure. So step 3 in your technology evaluation is to reach out to your vendors and confirm that they will be ready for the ICD-10 transition. This includes your practice management, your electronic health record, your revenue cycle partners such as clearinghouses and billing services. You need to speak with these vendors regarding their implementation plans and how they're going to impact you. The fourth step in our tech eval will be to submit test claims using ICD-10. Your technology vendor should guide you through this process. Be sure to ask them what responsibility your practice has regarding test claim submissions to payers. More than likely, system updates will be required that will need to be scheduled along with training for the new updated changes. So now that you're aware of your technology vendor plans, you will need to develop an implementation plan that will ensure that all of your staff will be familiar with any new software functions before the go-live date of October 1st, 2014. This needs to take into account any downtime for software updates and staff training that will be needed. So your technology can and will have a direct impact on your overall plan of implementation, and being in contact and in line with their ICD transition plans will directly affect your success. So now that we've identified our code, reviewed our charts, we completed a technology evaluation, we are ready for training, leading us to step number 5, education. So earlier in step 1 of this program, you assigned staff to specific roles in the practice workflow when creating your implementation plan. So now that you have a good understanding of who, where, and how clinical and administrative staff use diagnosis codes, it's now time to evaluate each staff member's needs. These will be used to help create an education plan to train the specifics. The training plan is going to be a multi-phase process and will include 2 phases. Number 1, a general ICD-10 introduction needs to be completed for all staff in the practice, giving each of them a general overview and understanding of why this ICD-10 transition is happening. This will be vital to their overall buy-in and making them feel a part of the process, thus ensuring an overall success of this huge change on your practice. Step number 2 is a specific instruction training, and this will need to be set based on the practice position and how that role is specifically affected by the ICD-10 code change. For example, coders and physicians likely will require comprehensive education, while nursing or medical assistant staff might only require a general overview. Consider the level of experience of each individual and develop your training plans accordingly. For step number 2 is determine your training methods. There are a variety of options for ICD-10 education, and you will need to determine the type of training preferred for your practice. You will need to think about whether to send staff off-site, leverage online resources like this webinar, or even partner with another practice or hire a consultant to come on site. The last step is going to be to practice, evaluate, and refine, and this can't be stressed enough. You can do this by starting dual coding. Code both in ICD-9 and 10. Utilize resources such as online tools or eBlast to sharpen your coding skills. And last, Superbill to chart comparison. Compare what is selected off your Superbill to what is documented into the chart. So now that we've prepared our staff for this major transition to our practice, we will need to be sure that we monitor their success moving forward. This brings us to step 6 and the final step of our 6 steps program. So vital to your practice success is number 1, to confirm your staff's ability to code in ICD-10. This can be done by quizzes and or review of the practice resources you've implemented. You also will need to be benchmarking your performance and monitor your implementation timelines. You want to assure deadlines are met and expectations are being met. Be sure to identify problem areas when they arise and immediately create plans of correction that address the problem. This is going to prevent large and more catastrophic issues from happening as you continue through this transition. Lastly, rejection denials need to be monitored and reviewed and errors addressed immediately. If you're not taking the time to complete this last and final step of the Success Program, the results could be damaging and directly affect the overall success of your ICD-10 transition. So now that I've shared each of the 6 steps for success, I would like to quickly recap each step and its purpose in this transition. Number 1, assess, create, and assign. You're going to create an implementation plan that will describe how the practice will successfully transition to ICD-10. This includes creating tasks and assigning them to responsible parties. You will need to consider important timelines, resources availability, and the financial impact to your practice. Step number 2, co-translation. Here we're going to complete an inventory of current ICD-9 codes used in your practice. Target your top 20% and begin the mapping of these codes to ICD-10. Number 3, chart review. You're going to review a statistically significant number of charts to confirm proper documentation in the present to support ICD-10 codes. All gaps need to be documented and addressed. Number 4, technology evaluation. Contact your technology vendors. Discuss their readiness timelines for ICD-10. Develop a plan for deployment per required update by each of your vendors. Number 5, staff education. This should be specific to the practice and the staff role and focus on your high priority codes. You can engage a certified training specialist to facilitate this transition smoothly. And lastly, number 6, monitor for success. As the deadline approaches, you should be interacting with new ICD-10 codes every day and providing additional education for the staff. Monitoring documentation and coding will help prevent unnecessary claim rejections come October 1st. So in conclusion, on October 1st of 2014, a key element of data foundation for the United States healthcare system will undergo a major transformation. ICD-10 is coming. ICD-10 is not optional. The dates of service beginning October 1st, 2014 and forward must be coded using ICD-10. Also, ICD-10 is a new language. It is not an annual update. This major change represents a looming disruption. Yet, no matter the trouble, the transition is necessary because the current coding system can't take healthcare into the future. Today's data needs are dramatically different than they were 40 years ago when ICD-9 was introduced. ICD-10 is going to advance healthcare in many ways, making strides in quality measurement, public health, research, reimbursement, and IT advancement. So as your practice advocates, we want to provide you with a list of ICD-10 resources that will further assist you in your ICD transition. It is highly recommended that your practice will need to purchase the new ICD-10 coding book. There are a variety of vendors available that have this for you. And also the follow 3 web links will provide you with training and other ICD-10 resources available to you and your practice. So as your practice advocates, we at NCG are excited to announce our ICD-10 bootcamp and consulting packages. We are offering a 1-day ICD-10 bootcamp. This will be a 1-day off-site training. It will include the ICD-10 book and training manual. You'll receive an in-depth review of the ICD-10 book and guidelines and have hands-on ICD-10 coding exercises. This is the perfect train the trainer package for your practice. We also will be offering a Leave It to Us consulting package. We'll do the work. NCG will walk your practice through all 6 steps to success. This includes a workflow assessment of your practice, your ICD-9 analysis with translation to ICD-10, chart audits will be completed, and then client-specific training based on the practice analysis. Your top codes and chart review will be completed. We also will complete all your vendor analysis for your technology needs, and we will do monthly chart audits and claim monitoring through the 10/1 deadline. This also will include an ICD-10 book and the specialty coding references. So we've reached the end of our presentation and now have time for some questions and answers. So thank you for attending our ICD-10 course. You are eligible to receive 1 CEU credit. Above is the certificate and the index number that you will need to be able to use to apply for your credit. If you have any further questions or need additional assistance to your ICD-10 planning, please feel free to contact either myself or Kelly as your provider advocates or email solutions@ncgmedical.com.